Autism is a developmental disorder that appears in the first 3 years of life and affects the brain's normal development of social and communication skills. Autism symptoms. Most parents of autistic children suspect that something is wrong by the time the child is 18 months old and seek help by the time the child is age 2. Children with autism typically have difficulties in pretend play, social interactions, verbal and nonverbal communication. Some children with autism appear normal before age 1 or 2 and then suddenly regress and lose language or social skills they had previously gained. This is called the regressive type of autism. People with autism may be overly sensitive in sight, hearing, touch, smell, or taste. For example, they may refuse to wear itchy clothes and become distressed if they are forced to wear the clothes. Have unusual distress when routines are changed. Perform repeated body movements. Show unusual attachments to objects. The symptoms may vary from moderate to severe. Communication problems may include cannot start or maintain a social conversation, communicates with gestures instead of words, develops language slowly or not at all, does not adjust gaze to look at objects that others are looking at, does not refer to self correctly, for example, says you want water when the child means I want water, does not point to direct others' attention to objects, occurs in the first 14 months of life. Repeats words or memorized passages, such as commercials, uses nonsense rhyming, social interaction, does not make friends, does not play interactive games, is withdrawn, may not respond to eye contact or smiles, or may avoid eye contact, may treat others as if they are objects, prefers to spend time alone, rather than with others, shows a lack of empathy, response to sensory information, does not startle at loud noises, has heightened or low senses of sight, hearing, touch, smell, or taste, may find normal noises painful, and hold hands over ears, may withdraw from physical contact, because it is overstimulating or overwhelming, rub surfaces, mouths or lips objects, seems to have a heightened or low response to pain, play, doesn't imitate the actions of others, prefers solitary or ritualistic play, shows little pretend or imaginative play, behaviors, acts up with intense tantrums, gets stuck on a single topic or task, perseveration, has a short attention span, has very narrow interests, is overactive or very passive, shows aggression to others or self, shows a strong need for sameness, uses repetitive body movements. Autism treatment. An early, intensive, appropriate treatment program will greatly improve the outlook for most young children with autism. Most programs will build on the interests of the child in a highly structured schedule of constructive activities. Visual aids are often helpful. Treatment is most successful when it is geared toward the child's particular needs. An experienced specialist or team should design the program for the individual child. A variety of therapies are available, including applied behavior analyses, ABA, medications, occupational therapy, physical therapy, speech-language therapy, sensory integration and vision therapy are also common, but there is little research supporting their effectiveness. The best treatment plan may use a combination of techniques. Applied behavioral analyses, ABA. This program is for younger children with an autism spectrum disorder. It can be effective in some cases. ABA uses a one-on-one teaching approach that reinforces the practice of various skills. The goal is to get the child close to normal developmental functioning. ABA programs are usually done in a child's home under the supervision of a behavioral psychologist. These programs can be very expensive and have not been widely adopted by school systems. Parents often must seek funding and staffing from other sources, which can be hard to find in many communities. Teak. Another program is called the Treatment and Education of Autistic and Related Communication Handicapped Children, Teak. Teak was developed as a statewide program in North Carolina. It uses picture schedules and other visual cues that help the child work independently and organize and structure their environments. Though Teak tries to improve a child's adaptation and skills, it also accepts the problems associated with autism spectrum disorders. Unlike ABA programs, Teak programs do not expect children to achieve typical development with treatment. Medicines are often used to treat behavior or emotional problems that people with autism may have, including aggression, anxiety, attention problems, extreme compulsions that the child cannot stop, hyperactivity, impulsiveness, irritability, mood swings, outbursts, sleep difficulty, tantrums. Currently, only risperidone is approved to treat children ages 5 to 16 for the irritability and aggression that can occur with autism. Other medicines that may also be used include SSRIs, divalproex sodium and other mood stabilizers, and possibly stimulants such as methylphenidate. There is no medicine that treats the underlying problem of autism. Diet. Some children with autism appear to respond to a gluten-free or casein-free diet. Gluten is found in foods containing wheat, rye, and barley. Casein is found in milk, cheese, and other dairy products. Not all experts agree that dietary changes will make a difference, and not all studies of this method have shown positive results. If you are considering these or other dietary changes, talk to both a doctor who specializes in the digestive system, gastroenterologist, and a registered dietitian. You want to be sure that the child is still receiving enough calories, nutrients, and a balanced diet. Other approaches. Beware that there are widely publicized treatments for autism that do not have scientific support, and reports of miracle cures that do not live up to expectations. If your child has autism, it may be helpful to talk with other parents of children with autism and autism specialists. Follow that progress of research in this area, which is rapidly developing. At one time, there was enormous excitement about using screening infusions. Now, after many studies have been conducted in many laboratories, it's possible that screening is not effective after all. However, research continues. Autism is a common disease, yet every individual needs unique treatment and care. We encourage people with autism and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about autism and how to treat autism, just click on the link at description or visit www.mainmd.com. Thank you.